Today we'll begin doing Gavage feedings. The supplies that you'll need for the Gavage feeding are your doctor's order, materials, gloves, and hand sanitizer for hand hygiene, stethoscope, Toomey syringe, litmus paper to check placement, prescribed formula, and water flush. This particular physician's order reads administer 250 cc's of Peptamen 1.5 with 100 cc's of water flush per NG tube every 4 hours. So that's what we'll be administering in this video today. Good afternoon, Mr. Jones. I'm here to give you your tube feeding. We're going to set you up in the bed a little bit. You need to have the head of your bed elevated. I need to check out your belly, do a little bit of an assessment. So I'm going to address my general principles and safety practices, hand hygiene, gloves, correct patient ID. I'm going to begin by performing my focused abdominal assessment. I'm going to inspect the abdomen, auscultate all 4 quadrants for positive bowel sounds. Of course, if I don't have bowel sounds, I don't want to put anything down the tube. Bowel sounds are good. I'm going to lightly palpate for any tenderness, masses. And I'm going to ask the patient if he has any abdominal discomfort, verify that his bowels are moving and that he's passing gas. And I'm now ready to begin preparing my patient for the feeding. I'm going to place a towel across his chest. At this time, I'm going to check the placement of my tube by administering an air bolus and auscultating as I inject. Should hear the belly growling. And I hear positive gurgling. I'm then going to aspirate gastric contents to check for residual. I got less than 30 cc's before it stopped, so that's good. I'm going to allow the gastric residual to go back into the patient's stomach. And once that has completed, I will dab a little bit off of the feeding syringe onto my pH paper and check the pH, which should be 0 to 5. Now that I've confirmed placement of my tube, I want to begin my feeding with 50 cc's of my water, at least half. And I'm going to allow gravity to let that flow into the patient. We want a nice steady rate. And prior to the syringe becoming empty, we want to clamp it off so that unnecessary gas doesn't enter the patient's stomach. We'll then administer the full 250 cc's of tube feeding, filling the syringe each time and letting it flow in by gravity and clamping before it gets completely empty. Once the entire container, prescribed amount of Peptamen has gone into the patient's stomach, I'm going to administer the remainder of my flush to clear the tube and prevent clogs. I'm going to allow that to run in, and right before the tube gets empty, I'm going to clamp the tube. I'll remove the syringe, re-occlude my NG tube either with a plug or loop, and I will place it back at head level with the patient, securing it either to the gown or the pillowcase with tape. I'm going to return my patient to a comfortable level, making sure that I leave the head elevated 30 to 45 degrees at all times. I'm going to clean up my mess, perform hand hygiene, and ask my patient if he's experiencing any problems or discomfort. At this time, I'm going to document my feeding: 2, 14, 18, 12 noon. Gavage feeding of Peptamen, 1.5 calories, 250 milliliters administered per NG tube. Placement verified via auscultation of air bolus administration and aspiration of gastric contents pH 3. prior to flushing and feeding. 50 milliliters of water flush prior to and after Peptamen administration. Patient voiced no complaints of discomfort when asked. Gastric residual of 45 milliliters noted prior to Gavage feeding.